Friends, hi, this is Dr. Mary Zenit, your host on Health Matters. We have a very important topic today. In this economy, we are all overworked, exhausted, malnourished, and looking for a quick fix. We see different products on the market that claim to get us up and running, but do they really work? Many experts say that it is a process to improve fatigue, including a balanced diet, exercise, and relaxing in those few minutes that we have. Here to help us today, we are truly privileged to have an expert in these matters. Dr. Kent Holtorf, a leading expert in chronic fatigue syndrome, is a diplomat and a board examiner for the American Board of Anti-Aging Medicine. Dr. Holtorf received his doctorate of medicine from St. Louis University with residency training at UCLA. He has personally trained physicians from all over the country in the use of bioidentical hormones, hypothyroidism, chronic fatigue syndrome, fibromyalgia. He was the founding medical director and developed the protocols for fibromyalgia and fatigue centers and other centers across the country. Doctor, thank you so much for joining us.
Hello, how are you?
We are wonderful, and we really look forward to hearing from you. There's so much to discuss. Today, let's focus on the topic of fatigue in America. It sounds like it's an epidemic today. Would you agree?
It really is. America is fatigued. And there are so many problems for that, and often it's multifactorial. You know, stress plays a big part in fatigue, and we're finding is that, for instance, even let's just take thyroid, for instance. And what we're finding is that stress will lower thyroid levels by about 20 to 30%. But the big problem is that the standard blood test will not pick it up. And so most doctors will go in and, hey, I'm fatigued and I'm gaining weight, and basically I'm stressed out, and doctor, oh, you're just getting older, or you just need to exercise more. And we're finding that about what happens, their free T3 level, the active thyroid level, drops about 30%. But the standard blood tests look normal. So what happens is, and that will drop your basal metabolic rate, your metabolism, by about 30%, 20 to 30%. So it doesn't sound like that much, but you look, that's about a 200 to 300 calories that you have to make up just from stress. So it equates to about a half pound a week just because you're stressed versus your optimal thyroid levels if you weren't.
So, doctor, when a patient comes in, for example, as a psychiatrist, I see patients all the time, and we'll see in the emergency room, people come in and they'll run a T4, a total T4, and a TSH. And for our audience, let's go over that just a little bit. Those are the standard labs. You're saying that those labs are not enough.
Correct. So what we learn in medical school is that thyroid's very simple. So basically, the thyroid-stimulating hormone produced in the pituitary in the brain tells your thyroid that's in your neck to secrete T4. T4 is inactive thyroid. Then the body should convert it to T3, which then you have active thyroid. That's kind of the gas pedal for the body. And what is found, so normally it was told is that when your thyroid levels drop, your pituitary senses that, and it will increase if your thyroid levels drop. But the problem is with stress, also even with just dieting, and also systemic illness, even diabetes, autoimmune disease, is that what happens is not a problem with the amount of thyroid produced generally, but it's the way it's metabolized. There's a decreased T4 to T3 conversion in the cells. So normally the pituitary would sense the low thyroid and increase TSH, but that doesn't happen because actually the body, it's more of an intracellular in the body, in the cells in the body, there's not enough T3. But the pituitary sees enough thyroid. So the pituitary is very different. So what happens is they check a TSH and a T4, and those look fine. But what they're not checking is a free T3 and a reverse T3. So what happens with these illnesses, with stress, with dieting, diabetes, the body will not convert the T4 to T3, as we just talked about, but it'll go to reverse T3. Now, reverse T3 is like it sounds. It's basically thyroid T3, but backward. It's like a mirror image. And what happens, normally a thyroid will go to the receptor, stimulate the cell, and you have metabolism, you have energy, you have brain function. But reverse T3 will go there and stick in the keyhole, but not do anything. So it's an anti-thyroid, and it blocks the thyroid. And so the body produces that to kind of lower metabolism. And so what happens with these conditions is that the T3 in the cell is too low, but the reverse T3 is too high. So the best marker is the T3 reverse T3 ratio, not the TSH and the T4.
And doctor, if our doctors do order these, suppose they see a low free T3 or an elevated reverse T3 coming from stress, which we see tons of people, which I can almost promise you this is their thyroid profile, what then do you as a specialist recommend for these patients?
That's a very good question. And you also see this with depression. Very commonly with depression. Now, so the problem is when these people come in and kind of studies show, well, if you give standard thyroid preparation, it doesn't make much difference, which is T4. But the problem is, again, it's the problem with T4 to T3 conversion. So it doesn't, of course, T4, it makes sense that T4 is not going to work very well. So you have to give T3, which is the active thyroid, and shown to be significantly beneficial. And I'm sure you're aware of the studies on depression. And Synthroid doesn't really, and Levoxel, which are T4, doesn't do much good. But the psychiatrists are ahead of the curve on this. And even though they may not kind of know why a lot of times, why it works, but they found, T3 is now one of the recommended treatments for depression. But for instance, you look at depressed patients, they have a low normal TSH, a high normal T4, and a low T3, and a high reverse T3. So they're kind of that classic picture. And you'll even say some texts show that think the patients are high thyroid with depression because they have a low TSH and a high T4, but it's exactly the opposite. But these patients need T3, not T4.
Wow. And are there different forms of T3 that these patients can take?
Yes, there are. And so the standard T3 preparation is Cytomel. That's available at regular pharmacies. And the problem is it's very short-acting, and you need to take it 3 or 4 times a day. So it becomes very problematic, and that's one argument that doctors use. Well, I don't like to give it because it's just too difficult. What happens, you get very high levels and it goes down.
Right.
You have to give it multiple times a day. But you can, compound is a time-release T3, so now you only have to take it once a day.
And where can patients get this? Where can the
So
doctors?
From compounding pharmacies.
And there are some, can we explain to our listeners what a compounding pharmacy is? I know here in Colorado Springs, we have one that's very popular. What's the difference between a compounding pharmacy and a regular pharmacy like our in our stores, our Walmarts and our Target pharmacies?
Right, and it's a very good compounding pharmacy I like in Colorado. There is ITC. But yeah, so compounding pharmacies are pharmacies that are more specialized in customizing medications. So they can do different strengths, different delivery systems. For instance, like with estrogen, you can do sublingual, you can do creams and gels, and also a lot more options for even the same hormone, or you can do also custom dosing. So they really specialize in custom formulations. So, for instance, they can take the T3, instead of giving it Cytomel, they just have it in a tablet, which you get at a regular pharmacy. Now they can make it into a time-release version. So now you just have to take it once a day.
Wow.